I am first and foremost a father and husband. I am a critical care physician at Sunnybrook Hospital in the University of Toronto. I work at University of Toronto also to direct a graduate research program in clinical epidemiology, and I'm a clinical lead for the World Health Organization with respect to infectious outbreaks in different parts of the world. I grew up in New Brunswick, went to school in New Brunswick, and I come from a family with a strong UNB tradition. I think I've counted 11 family members over 6 faculties that have attended UNB. Although I spent a lot of time in the library and science labs, I would say my favorite memory is without a doubt my classmates and friends. Even despite years and distance, many of them remain my closest friends.
So Rob and I went to school, elementary, junior high, and high school, and then it led us to University of New Brunswick. We were there from '87 to '91. Privately, he's a very funny guy, but professionally, he's very diligent and thoughtful. His approach to people is so respectful. UNB helped Rob and many of us as a stepping stone for the start of our careers. I think Rob determined, like sort of midway through his science degree, that he was going to become a doctor.
I remember Peter Cashin's biochemistry course and Professor Jim Wigg's physiology course as two that really made me want to stay with science, particularly with biology, and I think opened my eyes to medicine as a potential career.
He did a lot of work sort of early in his career when SARS hit Toronto. He was one of the first people involved at an early part of his career in dealing with that. It was quite serious, and people forget. Many years later, he took a sabbatical to the World Health Organization. I don't think he imagined at that time of a sabbatical year how much he was put into action during the first Ebola outbreak in West Africa. He was so humbled about it and didn't talk about it, still doesn't talk a whole lot about it, but we came to learn through his peers and other universities and professional associations started recognizing his work and another colleague for reducing quite significantly, I think almost 50%, the mortality rate of Ebola victims.
Growing up in the Maritimes and growing up in Canada, having the opportunity to attend UNB, you are left with a sense of community, a sense of naturally wanting to help other folks out. That sets a great example that carries through whatever your profession is and whatever you might do in the world thereafter.
New Brunswickers don't toot their horns very well. It's also our strength because we're humble people, and Rob represents that so well.
I can't overstate the importance of my education at UNB. When you have the opportunity to learn from terrific teachers and gain support that gives you really the option and confidence to do things even beyond your primary training, it's just a wonderful opportunity, and UNB was all of those things.